Our next story is about greed. The greed of big pharma, the unrelenting desire to maximize profits at the cost of human lives. The latest case in point is Moderna. It's an American pharma giant. It was in the headlines during the pandemic. It made a high-profile vaccine. The vaccine was given for free in the US. It was free for the people, but the US government paid for it. The government bought Moderna vaccines, which were then given free of cost to the people of America. You can imagine how big the government order was. It ran into millions. And now it's ending. The US government will not buy Moderna vaccines anymore, so the company will have to take it directly to the consumer. And Moderna likes the idea, because now it can set the price of the shot. Do you know how much they want to charge? $130 per dose. $130 for one injection. That's more than 10,500 rupees for one dose, and that's not even the most shocking part of it. Moderna is jacking up the price by 400%. The US government paid $26 for one shot. Moderna now wants Americans to pay $130. It's outrageous. How do they justify the new pricing? Listen to this.
So the price is not linked to the company's performance. The price is linked to the value of a product, to the patient, and to the impact on the patient. That's how we set price.
Let's revisit that statement. The price is linked to the value of a product, to the patient, and the impact on the patient. Well, by that logic, the greater the value of a drug for a patient, the greater should be its price. That's what happens when you treat life-saving medicines as mere commercial products. And Big Pharma is notorious for this. The Moderna CEO says he has made up his mind. He was called before a committee of American lawmakers. Look at the exchange.
My question to you is, given the fact that you have made billions of dollars, that your company has made huge profits, on behalf of the taxpayers of this country, will you reconsider your decision to quadruple the price of the vaccine?
The volume we had during the pandemic gave us economies of scale we won't have anymore. That is what is different.
That's the defense. The numbers are no longer adding up, he says. Well, let's look at the numbers then. How much does Moderna spend on making one dose of this vaccine? $2.85. That's it. That is the cost. And now they want to sell the same shot for $130. We understand that you want to cover the R&D costs, but this is a markup of more than 4,000%. This is loot, and you cannot justify it. Most businesses would be envious of profit margins like that. One US lawmaker says this is, quote unquote, unacceptable corporate greed. His name is Bernie Sanders. He wrote a letter to the CEO of Moderna. I have a copy with me. This is what it says. Now, in the midst of a continuing public health crisis and growing federal deficit, is not the time for Moderna to be quadrupling the price of its vaccine. Now is not the time for unacceptable corporate greed. And he's right. The vaccine has already made billions for Moderna. In the last 2 years, Moderna has earned $18 billion in profits. Where did this money come from? From its Wuhan virus vaccine. Moderna's investors have become multi-billionaires. Meet Noubar Afeyan. He's Moderna's chairman and co-founder. He's worth $1.7 billion now. Robert Langer, another co-founder of the company. Again, he's worth $1.7 billion. Timothy Springer invested in Moderna. His net worth today is over $2 billion. And what about the CEO, Stéphane Bancel? His net worth is well over $4 billion. Moderna and its top management made a killing from this pandemic. And this was no coincidence. This was by design. For the longest time, Moderna has supplied its shots almost exclusively to rich countries, to countries which could pay a premium. They're the ones that got the vaccine. And Moderna did this more than any other vaccine manufacturer. I have some numbers. In October 2021, Moderna supplied just 1 million doses to poor countries. The company made a shift only a few months ago. In October 2022, it decided to supply 100 million doses to lower-income countries. And the vaccines are expected to reach these countries later this year. The story doesn't even scratch the surface of how Big Pharma holds the world hostage. Moderna's 400% price hike is just one glittering example. We'll dig out the rest some other time.